In order to pass the OET role play, it's really important that you use the right language to talk to the patient and find out and explore their concerns. Watch this video to find out how. Hello, I'm Jo from Specialist Language Courses. We are OET Premium Preparation Providers, which means you are in the right place for your OET. Don't forget to subscribe to our YouTube channel and hit that bell so you're notified every time we upload a new video. Let's begin. In the OET speaking test, you begin with a warm-up section where you're asked a few questions. This lasts 3 to 4 minutes and is not assessed. You are then given 2 to 3 minutes preparation time to read through a role card and then 5 minutes to perform a role play. This is then repeated and you are given your second role play and another 2 to 3 minutes to prepare. You will be assessed on 2 different sets of criteria, the linguistic criteria and clinical communication criteria. And in this video, we're going to look at how to speak to patients using the right language, which will help you score highly here. Specifically, we're going to look at A, relationship building, and B, understanding and incorporating the patient's perspective. Let's take a look at relationship building first and what this criterion actually means. There are 4 indicators for this part. First, we have initiating the interaction appropriately. So think about how to begin the conversation. Is this the first time you have met? Is the person distressed and needs empathy from the very beginning? Demonstrating an attentive and respectful attitude. Listen to what they say and respond using professional language. Adopting a non-judgmental approach. A good example of this would be, if you could try and do some exercise, this would help your cholesterol, compared to, you have high cholesterol because you don't exercise, which could make the patient feel that you are judging their lifestyle choices. Showing empathy for feelings, predicament, emotional state. Build up a variety of different ways of showing empathy so that it sounds genuine. For example, I understand that you are worried. That must have been scary. I can see that you're worried. I know you don't want to. During the OET roleplay, there will be many opportunities to demonstrate empathy. Let's look at some example contexts where you need to do this. A patient might feel guilty due to an accident at home. Or perhaps the patient feels silly suggesting a diagnosis. They might also feel embarrassed about a sensitive or personal issue. Maybe they find something difficult to do due to a busy lifestyle, or they're going through difficult times, or the death of a relative when asking about family history. It's a good idea to think of possible situations and create a language bank with useful phrases that you can adapt appropriately for the role play. Can you think of a phrase to use for each of these situations? Let's take a look at some possible examples. For guilt, you could say, these things are very common. Children often tend to. Try not to feel bad. You did the right thing, or you made the right choice. If the patient feels silly, you could say, it's not silly at all, or it's perfectly understandable to think that. When dealing with embarrassment, we could say something like, I know this is a bit embarrassing. Do you mind me asking? Or, sorry I have to ask you this, but... And dealing with patients who are reluctant to change their lifestyle is very common in the OET. So for this, you could say something like, I understand it's hard for you. We all love our chocolate. I know this isn't easy for you, or I appreciate you don't have much time. And for patients who are going through difficult times, it's important to listen carefully and respond appropriately with something like, that must be very hard on you. That must have been very frightening. Or, that's a hard thing to go through. Try and be natural and think about how you would respond in a real situation to a patient who's feeling these emotions. Now let's take a look at understanding and exploring the patient's perspective. So the first indicator is eliciting and exploring the patient's ideas, concerns, and/or expectations. This means you need to find out what the patient is worried about, find out ideas they have about what's happening and what they are hoping for and expecting. Picking up patient cues means you need to listen to what they say and acknowledge it and respond appropriately rather than just working through the tasks. And finally, we have relating expectations to elicited ideas, concerns, and expectations. And you can do this by giving explanations which will answer the patient's questions, concerns, and ideas. One way to help you remember this is to use ICE. This stands for Ideas, Concerns, and Expectations. Let's look at some examples. To find out what their ideas are, you could say, "Can you tell me some of your thoughts on what might be going on?" Or, "Do you have any idea what might be causing it?" It's important to elicit the patient's concerns and explore them appropriately. For example, is there anything that worries you about your symptoms? Is there any reason why you're particularly worried about that? And to find out what the patient is hoping for or expecting, you could say, "What were you hoping for in today's consultation?" Or, "What would you like to happen?" but only if appropriate to the situation. So let's put all this into practice by taking a look at a sample role play. Let's go. So while we're preparing for the role play, we need to predict how the patient may be feeling or any concerns they may have. For example, we can see here that we need to find out about how the patient feels about the insulin injections. So we could say, "Can I ask you how you feel about that?" We then see that you need to explore the patient's anxiety. So we might say, "Sorry to hear you feel that way. Could you tell me more about what is worrying you about it?" The task then asks you to reassure the patient. So you could say, "I do understand that it scares you, but it will get easier with practice." We also have to explain. And it's important to pause and check. And we can involve the patient while we do this by asking, "How does that sound? Is there anything that you would like to ask me?" This will involve them in the conversation and elicit any further concerns. Let's have a look at another one. Here we can see the patient is recovering from an acute myocardial infarction 2 weeks ago and that they are concerned about how much physical activity is appropriate during recovery. So you can predict that you will need to be reassuring and showing empathy throughout the role play. Can you think of some language to explore their concerns? So the second task asks you to reassure the patient. So you could say, "I understand that must be worrying you. It's perfectly normal for you to feel this way at this point." You then need to explore their work. So you could use an open question so they give information. For example, "Can you tell me a little bit about your job?" Then explore any further concerns by asking, "What concerns do you have about returning to work?" And finally, you need to reassure the patient by saying something like, "I know this has been a shock and that you're concerned about your recovery, but I'd like to reassure you that it's all perfectly normal." Make sure you use the preparation time effectively to think about opportunities for demonstrating empathy and how you might explore and respond to patient concerns. Okay, so let's recap my top tips for dealing with patients in the OET role play. Create a language bank with useful phrases to use. Use the preparation time effectively in the exam. And practice. Speaking is a skill and the best way to improve is to find someone to practice with. If you can, record yourself and review what you've done so you can see how effectively you communicate and succeed in the OET exam. I'd like to know what phrases you use to demonstrate empathy in the OET speaking. Let me know in the comments below. And if you like this video, please like and share with your friends and colleagues so we can help more people achieve success in the OET exam. Don't forget to check out our website, the link's below, to see how we can help you prepare for the exam. See you in the next video. Bye. I realised at the same time. Okay, and then during the OET roleplay, there will be many opportunities to show roleplay. Dear. Think about opportunities for showing empathy. More or less.